Welcome to radiologyinfo.org. In this short video, I would like to help explain to you how to read your magnetic resonance cholangiopancreatography or MRCP report. MRCP helps your doctor diagnose the cause of abdominal pain and jaundice. The test also helps figure out the cause of an abnormal liver function test and to diagnose diseases of bile duct, liver, gallbladder, and pancreas. Remember that your radiologist wrote this report for your healthcare provider, and that can make it hard to understand. Some medical terms, such as abnormal, may look scary but may not be serious. Your doctor can explain any findings mentioned in the report. Many of these findings are common in many patients and will cause you no harm. Write down any questions you may have and talk to your provider or ask if you can speak to the radiologist directly. A typical MRCP report will include several sections: clinical history, technique, comparison, findings, and impression. Clinical history. This section includes the clinical reason for the scan. Technique. The technique section describes how MRCP was done. MRCP is a specialized MRI test that focuses on biliary and pancreatic ducts without the need for IV contrast. Instead, it uses special techniques that makes fluid-filled structures like the bile duct and pancreatic duct look bright on imaging. It is a non-invasive and radiation-free test. Comparison. If there is a previous imaging test such as ultrasound, CT, or prior MRCP, it will be referenced in this section to see if there is any change in the appearance of ducts, liver, or pancreas. Findings. This is the most detailed section and forms the core of the report. Biliary tree. The radiologist will assess the common bile duct, intrahepatic ducts, and gallbladder. They will look for dilatation, stricture, which are narrowing or filling defects, which might be from stone, tumor, or inflammation. For example, a stone in the CBD will be described as T2 hypointense, filling structure in the distal CBD with upstream biliary dilatation. Biliary ductal dilatation is generally considered to be significant if the CBD is more than 6 to 7 millimeters in diameter, but this may vary slightly with age or if the gallbladder was previously taken out. Pancreatic duct. This includes evaluation of main pancreatic duct for dilatation, irregularity, or disruption. Changes here could include chronic pancreatitis. The main pancreatic duct should be less than 3 millimeters in diameter. Gallbladder. The MRCP can also identify gallstones, gallbladder wall thickening, or signs of cholecystitis. Stones are typically seen as dark structure within the bright bile. Though MRCP is focused on ducts, radiologists may comment on nearby structures such as liver, pancreas, and duodenum, which is the first part of the small intestine. Liver lesions, pancreatic masses, or signs of inflammation or buildup of fat in liver may also be included here. The report may also note if there was motion, intestinal gas, or patient anatomy that made it hard to see some structures. Impression. The impression section summarizes the findings that the radiologist wants to make sure your doctor or healthcare provider is aware of. It lists radiologist conclusions and makes recommendations for further evaluation or additional testing. If the MRCP is normal, it may read unremarkable MRCP, no evidence of biliary obstruction, stones, or pancreatic ductal abnormality. If any abnormality are detected, such as choledocolithiasis, which are bile duct stones, strictures, or a suspicious mass, the radiologist will highlight them here and may recommend further testing, such as endoscopic ultrasound or ERCP, to help diagnose and to treat these conditions. Remember, your radiology report is written for your healthcare provider, and that can make it hard to understand. Write down any questions and concerns you may have and talk to your healthcare provider about any next steps. For more information about MRCP, visit radiologyinfo.org. Thank you.